Hi, how are you? My name is Willo Ln, and I am the treatment liaison over at New Directions for Women in Costa Mesa, California. We are a women's substance abuse treatment center and working with health dimensions to share a little bit about what we've seen in the COVID pandemic and things that we can do in the HR space to help our employees. So, knowing that the COVID-19 pandemic is one of the most dynamic crises that any of us have faced in our lifetime, coronavirus is all over the news, but addiction and overall mental health are also critical issues that need to be addressed and taken note of during this pandemic, especially for companies like yours who are looking to support their employees in every way possible. Right now, the general public is being told to stay away from others, and quarantining at home, as we know, comes with its own challenges for people, especially people at risk of substance use disorder. As schedules and routines go out the window, all members of the family are home, including young children, working from home spouses, we're teaching, we're taking on new roles, and then adding the virtual happy hours, wine Wednesdays, and especially in the professional setting within companies for networking. Using drug and alcohol to cope can quickly onset into addiction or relapse when exacerbated by job stress, financial loss from furloughs or pay cuts, and worrying about the future of one's business or company. An appropriate response to the coronavirus pandemic by employers must include easier access to behavioral health care options and a greater understanding of how mental health and addiction rates continue to increase. Despite the stigma that may cause some individuals to perceive addicts and alcoholics as jobless, 75% of those struggling with substance use disorder were gainfully employed prior to the start of this pandemic. It's quite likely you have employees within your company misusing drugs and or alcohol, and especially during these times of uncertainty. So how can we help? Workplaces can be hesitant to take action when addiction and alcoholism are noticed because supervisors are unsure of how to address it. HR professionals can be key in supporting employees by providing resources, training, and just being able to recognize the signs of addiction. The longer an addiction goes untreated, it's more likely that illegal liability may incur. For example, according to the National Institute on Drug Abuse, people with substance abuse disorder are 4 times more likely to be involved in a workplace accident. Key physical indicators of addiction to watch for, and we typically teach, are falling asleep during work hours, having bloodshot eyes, or smelling like alcohol. And currently, many employees are working from home. And once the shelter-in-place orders are lifted, many businesses will continue to have staff working remotely. This poses a barrier in identifying such warning signs. So some behaviors to keep in mind during this time include constant emergencies, including tardiness, emergent patterns like calling out the day after payday, changes in work quality, mood and behavior changes, including avoidance of coworkers. This may occur remotely. Those who on Zoom meetings might not be utilizing the video chat or being active in online meetings, avoiding phone calls, and strictly relying on emails only. As human resource professionals, you have an integral role to play in supporting the employees. If any employee is willing to get help, they should be granted a leave of absence to seek treatment without being concerned that they'll lose their job. And this will become more cost effective, less disruptive to your business flow, and it limits potential risk. Substance use disorder is deemed as a disability per the Americans with Disability Act, and we can take this time to review our company's drug and alcohol policies to ensure that they're clear, supportive, and help employees with addiction struggles feel safe to come forward. Many individuals believe that they may be passed over for a promotion or even fired if they seek treatment for substance use disorder while employed. Unfortunately, this speaks to the stigma of the disease, as no one would feel the same way if they sought out treatment for heart disease or diabetes or other chronic diseases. Encourage your employees to utilize employee assistance programs If you don't have an EAP, like many small businesses don't, you can still assist employees by maintaining a current list of resources. We are happy to help if this is something that you need help gathering within your business. And most addiction treatment centers remain open as they are an essential business. We've been open throughout the whole COVID-19 pandemic, taking all the protocols, all the precautions, and being able to provide telehealth options as well. I hope this information was valuable to you. I hope you guys are staying safe out there and are well. I look forward to speaking with you guys soon when we're able to be in person again.